All right, this is National Wear Red Day. It's an effort by the American Heart Association to raise awareness of this silent killer of women. Since 1984, more women than men died each year from heart disease and stroke. And not only that, cardiovascular diseases cause 1 in 3 women's deaths each year, killing approximately 1 woman every minute. So what can you do? Well, you can raise your voice, advocate for more women-related research, and educate yourself. Dr. Dawn Huey, cardiac surgeon from St. Louis University Hospital, joins us on this topic. One recent research study, Dr. Huey, said diagnosing heart attacks in women can be more difficult than men. It turns out this blood test that doctors do looking for traces of a protein that might indicate a heart attack come up with a lot of false negatives in women. What's going on here? Is this something that doctors know about?
Doctors do know about this. This is pretty recent research. We've known for a long time that the basis of heart disease is different in men than in women. And heart damage occurs when there's blocked blood flow to the artery, through the arteries to the heart. In other words, the heart can't get the blood flow it needs. In women, the patterns of blockage are different than in men, so that may be the reason that the tests show up differently.
Okay, so we also found in this study that when the parameters were changed and the results were read in a more sensitive manner in women, that more women were diagnosed with heart disease. So does it mean the test shouldn't be thrown out completely? We just need to do it a different way? What are we finding?
I think that's absolutely right. The tests, when we use them in a different way, help diagnose more women. We know that heart disease is very common in women. As you stated, 1 in 3 women will die of heart disease. So there are ways that we can diagnose and treat better, and this test is certainly key to that.
What should women do then when they go to the hospital with some symptoms that may be different from men, but they think may be heart related? What can we do to get doctors to take a look at us in a different way?
I think education, certainly this program, educating the public, educating physicians, there is a lot of awareness. February being Heart Month is a great way to get the word out, and really recognition that vague or subtle symptoms that we often attribute to things like stress or other problems. The main symptoms in women are shortness of breath, nausea, and fatigue. And so recognizing that those could be signs of heart disease is very important. A risk factor is family history. That's another important one. So I think women, when they speak to their doctors, raising these concerns would be the key.
So don't look for that crushing, classic sort of, Hollywood version of a heart attack, right? That elephant sitting on your chest feeling?
Exactly. 2/3 of women who die of heart disease did not have classic symptoms. That's what they found. So.
Okay, so make sure you ask about that if you go into the hospital with something you think is not right. Dr. Dawn Huey, thank you so much from St. Louis University for joining us. Cindy, so important to talk about because I think we've all been taught through like the movies what to look for, and those symptoms sometimes aren't the case for women.
Yeah, you're very